We will talk about dandruff. Dandruff is a very common condition, especially among adolescents and young adults. What is dandruff? Dandruff is small white flakes which are shedding from our scalp. They are dead cells, dead skin cells. Now let's say, what is the most common cause of dandruff? It's dry skin. More than 50% of cases, dandruff is associated with dry skin. Dry skin happens because oil glands on our skin does not produce enough oil, and this skin cell turnover process is accelerated and they are shedding the white flakes. Now let's say about treatment. What is a treatment? Most common treatment and most effective treatment of dandruff is medicated shampoos, especially shampoos with ketoconazole or shampoos with selenium sulfide or with zinc, for example Head and Shoulders and such shampoos which have anti-dandruff action. They contain usually zinc or selenium or ketoconazole. So this three component is important and is considered very effective and first line. Also, coal tar is considered very effective, but it is reserved for more severe cases because it has some side effects and adverse effects, and it's very potent and it can irritate skin. That's why you should be careful with coal tar. But usually most commonly used medicated shampoos are with ketoconazole, selenium sulfide, and with zinc also. Now let's say about second most common cause of dandruff. It's Malassezia yeast infection. Malassezia is overgrowth. Malassezia is fungal infection, and this fungus is grow in our scalp naturally and normally. We have this yeast, but when there is overgrowth this yeast, we have dandruff also. So in many cases, also more than 50% of cases of dandruff is associated with Malassezia fungal infection. And we can say that this Malassezia infection and dry skin are commonly associated together. Yes, that's true. That's why we have almost similar treatment. What is the treatment? Treatment is still ketoconazole, shampoo with ketoconazole, which has antifungal effect, selenium sulfide. Selenium also has antifungal effect, and it decreases also cell turnover, and zinc also has antifungal effect, and it also decreases cell production. And coal tar, it has anti-inflammatory effect, antifungal effect, and it's more potent compared to others. They are first line treatment. Coal tar is reserved for more severe cases, and if they are not effective, then cyclopirox or fluconazole shampoos are used. They are considered more potent. And now let's say about third most common cause of dandruff. It's seborrheic dermatitis. It's more serious condition, more severe condition than just dandruff, because it causes flaky white or yellow scales. You can see these scales on the head. It can occur in other parts of the body, such as eyebrows, for example, or side of the nose or back of the ear, because these parts are rich in oil glands. And we have actually opposite position when we say about dry skin. We have dandruff because of dryness, but when we say seborrheic dermatitis, we have dandruff because of too much oil production. That's the difference. They are opposite conditions, but they can both produce and result dandruff. Also, during seborrheic dermatitis, Malassezia is important. Malassezia infection, Malassezia yeast infection is important player, and also important player is excessive oil production, and also several ages, for example, in adolescence, when there is spurt of androgens, oil production is increased, and this condition can be pronounced at these ages. What is treatment? Treatment are same as in case of dry skin or Malassezia infection, because here also Malassezia is important player. So antifungals are very important, such as ketoconazole, such as coaltar, such as zinc, and such as selenium. And corticosteroids also, if there is too much irritation, low potency corticosteroids are used, such as hydrocortisone 1%, or disonide 0.05%. So they can be used only short term, up to week. So we should avoid corticosteroids as much as possible due to their side effects and adverse effects. And fourth most common cause of dandruff is atopic dermatitis, which is also known as eczema. It causes dry, itchy, and inflamed skin. So we had seborrheic dermatitis. During seborrheic dermatitis, we have oil production, excessive oil production. And during atopic dermatitis, we have dry skin, and we have more allergic reaction. So during seborrheic dermatitis, we have excessive oil, we have yeast infection. During atopic dermatitis, we have dry, itchy, and inflamed skin. We have more inflammatory condition, more allergic condition, allergic in nature. What means allergic? Allergic means that we have triggers from environment, and our immune system overreacts to this trigger, and we get inflammation, we get itchiness, we get pain, we get redness, we get swelling. But it's not very common condition in meaning of dandruff, because atopic dermatitis common locations are different, such as hands, feet, legs, and knees. So it has different common locations. That's why scalp is not very common location for eczema, but it's still possible and it's still important. And what is the treatment of atopic dermatitis? Here we have important different treatment, because in other cases we had majorly fungal infection, yeast infection, Malassezia, but we have no such infection. At this case, we require moisturizers and emollients. What means moisturizers causing water retention in the tissues, so they help water retention in the tissue. This is the idea of moisturizers. And idea of emollients is that gaps between the skin to fill with fats, with lipids. That's the idea of emollients. So in case of eczema, most commonly used moisturizers are hyaluronic acid and glycerin. And from emollients, petroleum jelly is very cheap and effective emollient, which we should consider. And sometimes topical corticosteroids are required also if there is severe inflammation. And fifth most common cause of dandruff is improper hair care. What means too much shampoo or too low amount of shampoo. Both of them can cause dandruff. And how we need to define that we using appropriate amount of shampoo. We can define like this: if you have normal skin, not oily, not dry, then 2 or 3 times per week shampooing is enough for optimal hair health and optimal scalp health. If you have oily skin, every day or every other day shampooing is required. And if you have dry skin or curly skin, dry hair and or curly hair, and usually curly hair is very dry, once a week shampooing is enough. That's a key idea. You should not exceed shampoo amount, and you should not intake too less shampoo also. So you need optimal amount. For normal it's 2 to 3 times a week. For oily skin it's and oily hair it's every other day or every day, and for dry hair it's once a week. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.